Hello, my name is Dr. N Bajaj. I am an orthopedic surgeon, but 95% of my work relates to spine and spinal problems. Today I want to talk about spine pain in the geriatric patient. By geriatric, I mean the senior citizen and who comes to the clinic or comes to the OPD complaining of pain in the back. I must state that spine pain in the senior citizen is part of a pattern of poor health and has to be looked in a holistic manner at the patient. There are many causes of spine pain in the senior citizen, but what we have to decide is whether this back pain is sinister or dangerous back pain. By sinister or dangerous back pain, I am talking about things like cancer, I am talking of things like fractures, I am talking of things like infection, which can be life-threatening. We must also not forget that there can be non-spinal causes of pain. By non-spinal, I mean pain in the back that comes from the abdomen or from the contents of the abdomen, such as an aneurysm, or from organs such as the kidneys, or from organs within the pelvis. These very often present as spinal pain. So though the patient may have spinal pain, the cause is not in the spine, the cause is extraspinal. Degenerative disease of the spine is the commonest problem that one sees, and this is because of biochemical changes that occur in the disc. By disc, I mean the intervertebral disc. The simple back pain, which is called mechanical back pain or non-specific back pain, does not have any pain that goes to the legs from the back. It occurs when the patient sits or the spine is loaded in some way, as in standing or in walking. This pain responds very well to medication and to exercises and to physiotherapy. Rest is a myth. Beyond 24 to 48 hours, rest does not have a role. As time proceeds, as degeneration works on the spine, there are certain other changes that occur in the spine which lead to pressures upon the nerves, and we call this lumbar canal stenosis. Treatment of lumbar canal stenosis is also medication and physiotherapy and exercise. But when there is a frank weakness of the muscles of the foot or weakness of muscles of the leg, or pain is so agonizing that life is becoming misery, or when the patient is losing control of his urine and losing control of his stools, surgery is the only way out. As the degeneration progresses, one vertebra can slip over the other, leading to spondylolisthesis, what we call spondylolisthesis, or we can also refer to this as scoliosis as the disease worsens, in which the spine becomes crooked. When these need surgery, when a fracture occurs in the spine, either rest or an operation such as balloon kyphoplasty will be needed. Pain in the back can coexist with other conditions as well, in the neck, or with diabetes, or with other diseases, or with even malignancy. TB is endemic in our country and is frequently seen in the spine. We advocate that a biopsy be done to confirm the diagnosis and to get a specimen of pus which is sent to the laboratory for testing, for culture, to see which is the appropriate antibiotic. Spondyloarthropathy is a very common problem in our country and affects 1% of the population. It is manifest as morning stiffness. The patient goes to bed, wakes up in the morning with a stiff back, and over time this stiffness starts subsiding. There may be inflammatory arthritis and changes in the other joints. MRI scans, blood tests of inflammatory markers are useful. Senior citizens are often forgetful and anxious, and I encourage my patients to write down their symptoms and come to the OPD. I encourage them to be active because, as I said earlier, rest beyond 24 to 48 hours does not have a role. In the acute pain, application of ice is helpful, and this can be followed up by applying heat and by rubefacients. Yoga, physiotherapy, pulse dosing is helpful. My colleagues also like to try nerve blocks, facet joint injections, radiofrequency ablation, which also helps. When it comes to surgical decompression, a careful search for problems like diabetes, heart problems, kidney problems, dementia, multiple medications has to be carried out. Poor nutritional status, poor bone stock, social issues can all affect the outcome. The goals of treatment have to be realistic, and we would like to, as far as possible, mobilize the patient early. A multidisciplinary approach is the best. A word about preventing spinal problems is very important. Quitting smoking, a nutritious diet, exercises to increase core muscle strength, maintaining ideal body weight are steps in the right direction. Thank you.